Welcome to this week's edition of Cardiovascular Update, covering the latest breakthroughs. Brought to you by LucidQuest, this update highlights: a pilot study explored cardiac damage after polytrauma, utilizing transthoracic echocardiography. Right ventricular function was slightly reduced, with mitral and tricuspid valve regurgitations being common. Elevated troponin T and NT-proBNP markers were strongly correlated with trauma severity. In the area of heart transplantation, a retrospective study advocates for earlier conversion to Sirolimus-based immunosuppression. This change helps reduce coronary artery vasculopathy and kidney damage, showing a decrease in rejection rates when conversion occurs after 12 months. The treatment also enhances kidney function and lowers the risk of skin cancer in heart transplant recipients. For patients with advanced heart failure, the ALTFlow trial introduces a novel left atrial-to-coronary sinus shunt device. This device demonstrated improvements in Kansas City cardiomyopathy questionnaire scores and New York Heart Association functional class. Right ventricular function remained stable over a one-year period, with significant hemodynamic improvements, even in patients with high natriuretic peptide levels. Valcare Medical's Amend transseptal system has recently received FDA approval for an early feasibility study. This study will evaluate its safety and performance in treating severe mitral regurgitation, with the feasibility study beginning in 2025 and a pivotal trial set for 2027. In systemic sclerosis, cardiac MRI proves its potential to detect early heart involvement. Studies show that 65% of patients with systemic sclerosis exhibit abnormal cardiac MRI findings, even before symptoms emerge. The findings underscore MRI's ability to detect myocardial changes early, which could lead to earlier intervention. Finally, a study from the Karolinska Institute highlights the risks of withdrawing guideline-directed medical therapy in heart failure. Discontinuing medications like RAS inhibitors and MRAs increased the risk of heart-related death or hospitalization by 36 to 38%. The study emphasizes the importance of continuing these therapies, even after symptoms improve, with beta blockers reconsidered for patients who show significant recovery. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com or email us at info@lqventures.com.